Next, we will be showcasing Careware and their newly appointed CEO, Greg Florentin. Greg, the floor is yours.
Hello, everyone. My name is Greg Florentin, and I am the CEO of Careware. I have 25 years of healthcare experience running hospitals, medical groups, and innovative technology. And together with our visionary founder, Lindsay Friedman, and a team of successful and brilliant minds, we are smoothly transitioning through our product development and eager to push this extraordinary technology forward. I have fallen and I can't get up. That famous phrase, an alert one fall button, helped capture a multi-million-dollar industry 20 years ago doing one thing. Today, Careware is holding the future for a multi-billion-dollar industry doing more. But first, why the need? See, nursing home residents have 2 times the risk of falling when compared to other elderly people. And about 5,000 deaths per year are due to the negligence of nursing home staff. So each year, nursing homes receive a $4,000 citation per patient a month for these injuries or death in a resident, and that is costly. So what causes these injuries? Well, staff burnout, lack of supervision, inadequate training, and lack of technology. So what's the solution? Careware. Our patented technology creates the simple opportunity to track, monitor, and alert on patients and caregiver compliance. It's real-time and effective care that is communicated between the patients and a care team constantly. These patented devices and software continuously sends information to hardware receivers located in the rooms and throughout the facility, including patient locations, their movements, patient caregiver interactions, sleeping, bathing, and the list goes on and on and on. The data is presented so that the end users, who are administrators, caregivers, or even family members, can view the care on a day-to-day, 24-hour basis. In the market, there are over 15,000 nursing homes in the United States with over 2 million licensed beds. This is a growing billion-dollar market, and we're ready to take a cut. As you can see here, our only 2 direct competitors are Blue Willow and CarePredict. Neither ensure the compliance of care. We are priced significantly less, and our battery life is much longer, which may not seem like a big deal until you consider devices that need batteries changed or charged. And our other advantages, we have a dashboard for administration, so they can review how their employees are doing daily. We also have a caregiver dashboard. This provides a list of their responsibilities, alerts, and notes on the patient. But what happens when Grandpa George decides to leave his room for a midnight rendezvous with Phyllis from across the hall? Yes, nice try, George. There are alerts for every individual to ensure they are being attended to regularly. And what if Grandma Phyllis's family wants to know how she's doing lately? We also have a downloadable app so the family can be rest assured she is being cared for by Mary the caregiver. Great job, Mary. Careware is seeking $1.5 million for 25% of the company at a $6 million cap. This will fund product development for a market launch in Q1 2021. We also have solidified angels who are ready to jump on this tremendous opportunity, but are waiting for the lead. We have tested this product in a care home with nonverbal and non-mobile patients with bed turning and toileting, and it was interesting to see the caregivers were only 20% in compliance, even though they claimed they were 100%. And once administration stated there would be shift bonuses for proper care, the compliance shot up to 97%. So with a year 1 goal of 10,000 beds, we're expecting over $8 million in revenue. And we expect to add exponential growth as we add beds year over year. And I'm here to ensure we meet our timelines and milestones. So thank you very much, everyone. We are Careware, saving lives one at a time.
How you doing, Greg?
I'm doing well. How are you?
Doing well, thank you. To kick off the Q&A, in your presentation, you highlighted elderly care facilities. Are you also able to deploy this in a home health setting?
Yes, we can. It's not just care homes, and that's a great question because Careware is for both senior care facilities, home health, and really any environment where organizations need to monitor patients, as this is also where we have that distant advantage from our competitors. And so those patients can be monitored away from a facility and even in their own home. And they'll receive that real-time care data and still obtain the incentives and maintain revenue. And the great thing is with this, we're also in discussions with Metro Health, UH hospitals, and a 100-bed care home in Parma, Ohio, and a chain of care homes in Texas and Georgia. And we also have visiting angels. So we're really eager to get the next steps in our venture.
Great, thank you. One question from the audience. Does CareWare have an in-home application in the roadmap?
We do have that application process. And so a lot of that's going to be ready before the end of the year.
Cool, thank you. And then also, I'm assuming that given COVID, there's an increase in this product as family are really unable to see their family members. What does this mean for the care facility? And has low care rating has this led to like a low care rating and a lower level of compliance?
It does, and I'll give you the cost savings on it. On the care home side, the federal government will stop making payments from the Federal Centers for Medicare and Medicaid to nursing homes and care facilities unless it corrects a pattern of their quality and poor care. The facility would be barred from accepting any new Medicare and Medicaid dependent residents until they have two clean CMS surveys and about 12 to 18 months to correct any deficiencies. But using the CareWare, the lack of care will drastically decrease. And the Medicare pays around average about 55% of the costs. And so this revenue could be in the millions depending on the bed and patient size. And so this doesn't include any of the waivers, federal match, state general plan Medicaid, diversion programs, and select. And so there's an additional 30% in quality incentives, and specifically for many of the skilled nursing facility value-based purchasing. So and even on the hospital side, if anyone's very familiar with the hospitals, you know, through the Affordable Care Act, the government cuts payments to hospitals that have high rates of these readmissions, and that can come up to about $16,000 per patient for these readmissions. So hospitals will absolutely love any care facility having our product set up in their business to avoid these astronomical, yearly costs.
Great. Well, that's all the time that we have for today. So I want to say thank you, Greg, and thank you to the CareWare
Absolutely.
team. It's been a pleasure working with you and Lindsay over the last 12 weeks.
Yeah, it's been great. Thank you, everybody.